With the patient's mouth closed, inspect and palpate the lips for symmetry, color, edema, and surface abnormalities. The lip color should be pink in whites, and more bluish in individuals with darker skin. Lip symmetry, both at rest and with movement, is expected. No lesions should interrupt the distinct vermilion border between the lips and the facial skin. The lip surface characteristics are expected to be smooth and free of lesions. Ask the patient to clench his or her teeth and smile to observe the occlusion of the teeth. The facial nerve is also tested with this maneuver. Have the patient remove any dental appliances and open the mouth partially. Using a tongue blade and bright light, inspect the buccal mucosa, gums, and teeth. Expect the mucous membranes to be pinkish red, smooth, and moist. The tongue appears dull red, moist, and glistening. A smooth, yet roughened surface with papillae and small fissures is seen on its anterior portion. The posterior portion should have rugae, or a smooth, slightly uneven surface with a thinner mucosa than the anterior portion. The geographic tongue, an expected variant, has superficial denuded circles or irregular areas exposing the tips of papillae. The skin color and surface characteristics. The skin of the abdomen will have the same expected variations in color and surface characteristics as the rest of the body. The skin may be somewhat paler if not exposed to the sun. A fine venous network is often visible. Above the umbilicus, venous return should be toward the head. Below the umbilicus, it should be toward the feet. Note any scars and draw their location, configuration, and relative size on an illustration of the abdomen. The presence of scarring should alert you to the possibility of intra-abdominal adhesions. Note the location and contour of the umbilicus. It should be centrally located without displacement upward, downward, or laterally. The umbilicus may be inverted or protrude slightly, but it should be free of inflammation, swelling, or bulge that may indicate one hernia. Lightly place the diaphragm of a warmed stethoscope on the abdomen. Listen for bowel sounds and note frequency and character. They are usually heard as clicks and gurgles that occur irregularly and range from 5 to 35 per minute. Bowel sounds are generalized, so most often they can be assessed adequately by listening in one place. Absent bowel sounds, referring to an inability to hear any bowel sounds after 5 minutes of continuous listening. Use palpation to assess the organs of the abdominal cavity and to detect muscle spasm, masses, fluid, and areas of tenderness. Evaluate the abdominal organs for size, shape, mobility, and consistency. Begin with a light, systematic palpation of all 4 quadrants, or 9 regions, initially avoiding any areas that have been identified as problem spots. Lay the palm of your hand lightly on the abdomen, with the fingers extended and held together. With the palmar surface of your fingers, depress the abdominal wall no more than 1 centimeter. Light palpation is useful in identifying muscular resistance and areas of tenderness. Deep palpation is necessary to thoroughly delineate abdominal organs and to detect less obvious masses. Use the palmar surface of your extended fingers, pressing deeply and evenly into the abdominal wall. Palpate all 4 quadrants or 9 regions, moving the fingers back and forth over the abdominal contents. Palpating the liver could be done in different ways. One of them is with fingers extended, with tips on right midclavicular line, below the level of liver dullness, and pointing toward the head. Another alternative method for liver palpation is with the fingers parallel to the costal margin. Another maneuver is palpating the liver with fingers hooked over the costal margin. Palpate below the liver margin at the lateral border of the rectus abdominis muscle for the gallbladder. Healthy gallbladder will not be palpable. If you suspect cholecystitis, have the patient take a deep breath during deep palpation. As the inflamed gallbladder comes in contact with the examining fingers, the patient will experience pain and abruptly halt inspiration. This is called Murphy's sign.